want, there are multiple stakeholders when it comes to elder care. The elders themselves, the children, that those are they are the employees, and the corporates, as we talked about, and multiple service providers themselves. If we bring all of them together into one platform and enable an ecosystem to develop for providing better elderly care, so that would help. So that was the starting point of starting the EldersIndia.
Amazing. That close to 71.43 years of average age will be what we will achieve by 2025 in India.
Yes.
And close to 50% of 65 plus years aged people in the country will have single or comorbidity conditions. Now that's big. That's big. And in fact, 1/3 of 75 plus years aged elders will have one activity of daily living at a limitation. So there is clearly support required. There's clearly assistance required, and it can't be managed all by oneself. Really put it in words, I would say, and this is from experience, I would say, for me, elder care is a trusted support system that I can fall back on in providing the best possible care and the best possible attention to the elders at home in a holistic manner. It's just not about the medical attention. It's not just about taking care of their daily activities. It's also about going beyond that and providing some sort of company, some sort of a social network in which they can get connected with like-minded folks within their age group, and also live a life which they all feel good and happy about.
I think the basic moral task of caregiving that I think is being with them, being committed to them. Health is one part of it, but being with them, spending time with them. And we were so busy in growing, as we always say, in growing ourselves as an organization, as an institute, as India. We are so not ready for it. I have realized it last year, and for the whole year I'm going through it. We really need focus on this area.
We believe that, as an inclusive organization, the idea about supporting the caregivers is simply because we want them to bring their whole self to work. You don't cut yourself in half and say, this is my professional self and I won't talk to anybody at home while I'm doing that. It's unprofessional while I'm at home. It's not like that, right? Like the last 2 years, our homes have become our offices, right?
Yes.
Absolutely. Our lives have got intermingled without people really being able to do anything about it. So our children and our pets and our homes have become part of our official existence. In the same way, we believe that if we had to give, the idea behind this BRG is to support our people so that they feel that they are happier, they're engaged, their overall wellness is being thought about, right? Yeah. So we celebrate Grandparents' Day and blogs and stories, and we have children and grandparents' family days where they come in and, experience the office. We have been pushing our corporate to create a corpus to say it's not a volume game. We won't have 200, 400, 1,000 people signing up for this. But even if there are 2 people who believe that they are feeling supported for their elder care, would the corpus, like the additional fund that you create as a corporate, would the corpus support it in addition to what the insurance is doing, right? So some of those things over the period, like pushing policies a little bit, while on the ground we look at, engagement, happiness, all of those things for our people. Also from the policy front, we've been pushing the boundaries a little bit to say, okay, would you be willing to make that difference for one individual whose life would be better because he'd become a better caregiver,
It should not be left to good intentions of children. I don't think that is where we should leave elders to be as a system when we are talking of 350 million. Similarly, we would need something for older people where it's not left to chance, where it is professionals, irrespective of what they feel about it. If they do their job well, older people will be taken care of. We should brand it better. The moment we say it's an old age home, we have finished it.
Oh, yes, absolutely.
Why should we call it geriatric care? Is so nice to see, because I think as corporates, we are humans. We are people first.
Yeah.
People make corporates. Huh?
Yeah.
So if we understand this is the need we need to put forward, because not because we love them less or love them more, but because this is the right way to do.
So training the workforce and getting them sensitized about it, building that awareness is extremely important. So that's one thing that we are focused on. The second thing, we have always been very flexible with our workforce when it comes to their personal needs. There is a wellness program that we run through which we now have telemedicine support for our elders. So your parents can be living in a remote location.
Yes.
They have the access to the wellness program platform that is there for telemedicine. Support group. Can there be a support group that can be created that can provide that level of connect and that level of engagement for the elders, that will allow them to be a lot more independent, at the same feeling independent, if not independent, feeling independent, and being proud of how they're spending their life, right? Is there a way we can find someone who has a pan-India presence of elderly homes, elderly home service, elderly homes? That could also be a big benefit for our workforce. The third thing that I think we can all think about is helping employees at the same time their parents on financial planning.
Finding ways to build communities within smaller areas in cities. Because some of those which are on at the moment like peripheral conversations are not really mainstream. We only talk about healthcare, and we're just getting to start talking about mental well-being, but not all of this around the process of aging and still living your full life. And what can we do to make sure that they live their full life? I think more and more conversations, benefits, connects, databases, communities, which can, enrich themselves through each other.
Mental well-being of my employees. If they are feeling secure about their parents, if they are feeling their families well in control and everybody's happy back home, of course, they are mentally, feeling good. They're feeling secure. So I think, of course, that is one critical bit to me. At the same time, when I think from the head, because business will always look at ROI, and I do understand P&Ls become important in that context, but I think there could be a great benefit of productivity out there, right? Me taking long leaves and long set of leaves, etc., because I, need to take care of certain nuances back at home, versus getting this care for my parents where they are feeling a lot more independent and managing the show and still getting the love and care that they so need. I think if this comes into play, it would mean a lot better productivity, lower absenteeism, etc. That will automatically show actually in numbers in terms of.
I think there's a huge ROI for a program such as this. Apart from the psychological stress, depression, mood swings, resentment that we just spoke about, directly contributing to your health deterioration, which we discussed. There are other things that also get impacted, such as missed time at work, right? Loss of pay or income because of caregiving. Cutting back, your contributing hours at workplace. These factors can be reversed, and the organizations can benefit from having a totally focused and productive employee at work, who at the back of his or her mind is convinced that someone is looking after their responsibility, which is their parents, while he or she is going about doing their part of contributing to the workplace.
Must do policy intervention. One thing that has come in huge focus during the last couple of years is mental well-being of an employee. Factors, that take away from that, which would be my worry for my parents, my worry for my children, my worry for different things that I go through at home. If we can address as an organization all those factors through strong policy interventions to provide, support to our employees, I think it will really help enhance the productivity of the organization.
looking, as I told you, we're bringing all the stakeholders together, and each of these stakeholders have their own way to kind of extract value from this. For example, from an employee standpoint, you would need to look at, what kind of services that you can avail, right from home healthcare to safety, security. Some of these devices, can get integrated. Emergency responses we talked about. There is social connect opportunities. There is also recreational opportunities if you talk about, because elder care to us is a lot more than healthcare alone. And also financial security, the elders well that we talk about, that also sits on the platform. So it looks at it holistically, and from an employee standpoint, so regardless of where you're based, in another country or another city, you can track any of these, whether the service request has been acknowledged by the service provider, has it been scheduled, has it been delivered, and so on and so forth. And you can really keep track of that. And there are also communities that within the platform that you can be part of, which can enable you to have meaningful interchange of views and educate yourself on specific areas of interest.